Dr. Nicole Zappa. I am an orthopedic surgeon with Twin Cities Orthopedics, seeing patients at Osceola Medical Center, and in this webinar we're going to discuss reducing your joint pain. Just a few housekeeping items before we begin the webinar. The slides will be sent out after the presentation to all the attendees, and if you would like to ask a question, please use the chat messaging. You will be muted throughout the presentation, but if you'd like to ask a question, you'll be unmuted after the presentation is completed. Just a little bit about me and my background. I originally grew up in Minnesota. I graduated from the College of St. Benedict in Minnesota. I completed my medical school in Iowa. I completed my residency training in Michigan and fellowship training in foot and ankle surgery in Seattle. And I practiced in Green Bay, Wisconsin for 3 years prior to coming to Western Wisconsin and Minnesota with Twin Cities Orthopedics. And I'm happy to be taking care of Wisconsin patients again. Just an overview of the webinar before we begin. We're going to start with a review of joints. We're going to discuss the causes and symptoms of joint pain. We're going to discuss diagnosing joint pain and, of course, treatment options for joint pain. I think we're all pretty aware of what a joint is, but a joint is anywhere in the body where the two or more bones meet to form an articulation or a mobile part of the limb. Examples are hips, knees, elbows, and shoulders. Several things can cause joint pain. Probably the most common things that patients see orthopedic surgeons for joint pain. The first one would be arthritis. And arthritis is a narrowing of the articular cartilage or the joint cartilage in the joint. And that can cause swelling and inflammation, which then causes pain in the joint. The second most common reason would be an acute injury or a new injury. And that can be anything from an ankle sprain to an ACL rupture to a rotator cuff tear. Gout can also cause joint pain. It's usually treated by a non-surgical physician, but sometimes patients do need to see a surgeon for gout-type joint pain. So these are just a few examples of what can cause joint pain, but it's important that patients talk with their doctor about what's causing their specific joint pain. You should see a physician for joint pain if you have any sort of injury, if they can't use the joint or the limb the way they were before the injury, if there is any sort of redness or swelling or tenderness around the joint or the bone. Patients should also see a physician if they have had any sort of ongoing joint pain, anything that's lasted longer than 3 days. So emergency type symptoms would be any sort of severe joint pain, so knee pain to the point where you can't put any weight on your leg, arm or elbow or wrist pain where you can't move the joint. If you're having significant swelling or redness in the joint, and if you've of course had any sort of serious injury or you have any deformity in the joint or the limb. We always start by talking with the patient and doing a physical exam, so that's where we begin. After we have some of that information, we also almost always get an x-ray when patients come into the clinic. After we see that x-ray and after we've examined the patient, we can either make a plan and go from there with treatment. If we need any more information or more detailed images, sometimes we go forward with something like an MRI or a CT scan. Home remedies that patients can consider prior to thinking about anything like surgery are numerous. A lot of patients will start with something like the RICE method, which is rest, ice, and compression and elevation of the joint. No matter how much we weigh, losing weight often helps with joint pain, and we discuss that with some of our patients prior to talking about any sort of surgical treatment. The more we weigh, the more pressure and force goes across our joints. And lastly, sometimes with patients we'll talk about certain types of diet modifications that they can use to help reduce inflammation and which thereby helps with joint pain. Some other home treatments that patients could consider would be things like over-the-counter medications. So NSAIDs or non-steroidal anti-inflammatory medications can be an option. Those are things like ibuprofen and Aleve. Patients can also use something like Tylenol, but that's not an anti-inflammatory medication, so we usually do recommend something like an ibuprofen. Patients can do stretching programs at home. Patients can use topical pain relievers like lidocaine cream or Aspirin cream, things like that. Patients can also consider over-the-counter supplements like glucosamine and chondroitin, or vitamin D and calcium for joint pain. Of course, before you start any new medication, you should talk to your primary care doctor. So home types of exercises that patients can do prior to going to any sort of formal physical therapy include range of motion exercises, strengthening exercises, as well as aerobic exercises. And aerobic exercises include things like walking or swimming or biking or an elliptical machine. Range of motion exercises would include any sort of joint motion exercise. Strengthening exercises are usually with something that provides resistance, so a band or a weight, holding yourself up like a plank or anything like that. The benefit behind strength exercises is, of course, building strength and developing muscle. Muscles support joints. Building strength can decrease joint pain. Range of motion exercises help the joint to stay mobile. Stiff joints are usually more painful than mobile joints, so just taking a joint through a range of motion helps the joint to have any sort of progression of joint pain. So some tips before you get started would be to start low and go slow. So just do what you can tolerate, and as you can tolerate more and more, increase the intensity and or the frequency. I would suggest icing both before and after if that is beneficial for patients. So we usually recommend a low impact type exercises. So walking is an impact exercise, but it is low exercise. Something like swimming or an elliptical machine would also be low impact exercises. High impact exercises would include things like running or sprinting, any sort of jumping like box jumping or lateral motions, ladders, things like that. Those are high impact type exercises that initially I would suggest that patients avoid. So if your joint pain isn't improving with some home remedies or home treatments and you see your orthopedic surgeon, some of the treatments that you might discuss are things like injections. So we can do a corticosteroid injection into the joint, which is an anti-inflammatory type injection. There are lubricating types of injections for certain joints as well, things like the knee. Some other joints that don't qualify for those types of injections. There is formal physical therapy. So if that home exercise program that you were doing wasn't necessarily benefiting you, we can try formal physical therapy with a physical therapist. We have options like braces in the clinic, so knee braces and ankle braces. And again, this is all before we consider surgery or we talk about surgery. Some non-traditional options would include things like acupuncture or chiropractic medicine or cryotherapy. And then if a patient gets to the point where the patient and the doctor decide, none of these things have worked and it's time to discuss surgery, then that's when something like joint replacement surgery could be discussed. Throughout the course of working with a patient, if at any point their pain increases or becomes more intense than it has been, I ask the patient to come back and see us so we can discuss the plan moving forward. And of course, if at any point during their treatment their joint becomes red or hot or swollen or they can't put any weight on it, we want them to go to the emergency room right away to be evaluated. Thank you so much for joining me for this webinar. I hope it was helpful and informative. If you have any questions, you can use chat or turn on your microphone and ask the questions. You can also email your question to the email that is listed on the screen.